All right, you are about to learn a lot of incredibly important information. I'm Dr. Burt, and I want you to roll up your sleeves, all right? Because we're in for a real treat. All right, here we go. You guys are in for a real treat real quick. Hey, I'm Dr. Burt. Roll up your sleeves. I'm going to walk you step by step through the spinal degeneration process, which is going to start with the root cause of the problem, right? Which is also going to be the most overlooked cause that hardly any other doctor is going to look for. Now, fortunately, this is the only thing that I look for, which is why my patients all get such good results. Okay. Okay. What's the root cause? You are going to learn a lot of incredibly important information now and for you now. You are going to learn a lot of incredibly important information right now. Roll up your sleeves. I'm Dr. Burt. Hey, I'm going to walk you step by step through the spinal degeneration process, starting with the root cause of the problem, which is also the most overlooked cause of the problem. Here we go. You are about to learn a lot of incredibly important information right now. Roll up your sleeves. I'm Dr. Burt, and I'm going to walk you through step by step through this degeneration cascade. All right, we're going to start with the root cause, which is also the most overlooked cause that hardly any other doctor is going to look for. Unfortunately, this is the only thing that I do look for, and which is why we get really, really good results with our patients. Okay, Doc, what is the root cause we're talking about here? All right, ready? It's head and neck injury, okay? Most overlooked cause, head and neck injury, whether it started out with your neck being cranked on at birth, whether it was sports growing up, could be football, soccer, wrestling, basketball, a gymnast falling off their roof. Ugh. Here we go. You are about to learn a lot of incredibly important information. We've got 10 minutes. Welcome. You are going to learn. Welcome. You are about to learn a lot of incredibly important information, right? I'm Dr. Burt. Roll up your sleeves because I'm going to walk you step by step through the spinal degeneration cascade, starting with the root cause of the problem, which is also the most overlooked cause of the problem that I'll be diving into, right? Nobody else is looking at this region except me and except other upper cervical doctors that know what they're doing. Okay. So, Doc, what is the root cause here? You ready? It is head and neck injury, okay? Whether it started from your neck being cranked on at birth, whether it was sports growing up, football, soccer, wrestling, basketball. Welcome. You are about to learn a lot of incredibly important information in this short video. I'm Dr. Burt. Roll up your sleeves because we're going to take a deep dive into just the reason why spinal degeneration occurs. I'm going to walk you step by step through the process, starting with the root cause, okay? And it's also welcome. I'm Dr. Burt. Welcome. You're about to learn a lot of incredibly important information in this quick video. I'm Dr. Burt. Roll up your sleeves because we're about to take a deep dive. I'm going to walk you step by step through this spinal degeneration cascade, right? And we're going to start with the root cause. And it's going to be the most overlooked cause that nobody else is looking for, okay? We've got upper cervical doctors looking right here. That's what we focus on, and that's how we get the best results for our patients, okay? So, doc, what is the root cause of the problem here? You ready? Head and neck injury, okay? Now, whether that started with your neck being cranked on at birth, whether that was sports growing up, right? Football, soccer, basketball, wrestling, could be a gymnast falling on her head, a fighter taking a blow to the head, any form of concussion, right? Falling off of a bike, could be hitting your head on a cabinet, hitting your head, falling off of a roof. I've seen that one before. Just any sort of whiplash injury, could be from a car accident, but really anything that's going to quickly jolt the head and the neck, okay? Now, how many of you out there would say, gee, doc, you remember? John, you're getting older. Specifically related to spinal degeneration. Welcome. You are about to learn a lot of incredibly important information in this quick video. I'm Dr. Burt. Roll up your sleeves because we're about to do a deep dive into the cascade of spinal degeneration. Okay, we're going to start with the root cause of the problem. Now, it's also the most overlooked cause of the problem from my experience, right? Because the only ones looking at this problem are upper cervical doctors, okay? Now, fortunately, this is why we get such good results with our patients, okay? Now, you may be wondering, gee, doc, what is the root cause here? And I'm here to tell you it's head and neck injury. Okay, right there. Now, whether it started at birth, right, where the doctor cranked on your neck, welcome. You're about to learn a lot of incredibly important information. We got a short video here. I'm Dr. Burt. Roll up your sleeves because what we're about to do, we're going to take a deep dive into the spinal degeneration cascade, right? We're going to start with the root cause. Now, the root cause is also the most overlooked cause based on my experience and other NUCA doctors' experience, right? Because this is the only region where we're focusing on, right? This root cause, we're going to get to it. But this is why we're able to get such good results with our patients, is because we're looking here, okay? So now you may be wondering, okay, doc, what's the root cause here? Well, I'm here to tell you, we're talking about head and neck injuries here, all right? Now, whether it started at birth with your neck being cranked, whether it was sports growing up, right? Football, wrestling, soccer, basketball, could be a gymnast falling on their head, right? A fighter taking a blow to the head. Could be any form of concussion, falling off a roof, hitting your head on a cabinet, driving down the road and, you know, getting hit with a car wreck, right? We see these whiplash injuries, right? Anything that will quickly jolt the head and the neck, okay? Now, in regards to spinal degeneration specifically, how many doctors out there you think would say, hey, John, you remember that day you dove headfirst into the empty pool? By the way, that actually did happen. But by the way, John, that's what initially caused your spinal degeneration. Do you think you'd see that? No, absolutely not. You know what they'll say? They'll say, John, you're getting older, and it's just you're just compressing your back, getting older, and that's what's causing your spinal degeneration, right? You're not exercising, you're overweight, and just all of that stuff. What I'm here to tell you is that as politely as possible, right, the initial cause of the head and neck injury is coming from the head and neck injury, okay? You never ever want to underestimate the importance of the head and the neck, whether you know the science or not, okay? Unfortunately, that's what we are going to be doing a deep dive into. But if there's one thing that you learn from this, please, please, please know how important this area right here is for you, right? Where the head meets the neck. Be conscious of it. Take care of it. Okay. Now, here is the overview of what we're going to do and how the spinal degeneration is going to occur. We're going to start up here with the head neck injury. Now, when the head neck is injured, you're going to notice a couple things immediately. First, it will tear loose and stretch the connective tissue that basically holds the head center over the neck, right? It's mainly the upper cervical ligaments that are going to be stretched here. But you notice this animation here. You can tell that when this happens, right, we call this an upper cervical misalignment because the top bone, the atlas, has shifted out of its normal position, causing the head to tilt and the lower neck to angle underneath it. Now, when this happens, the muscles that are hanging on to these bones are going to stretch. Now, I'm here to tell you that these 4 muscles here, well, there's 8 in total, 4 sets, but these muscles are the most sensitive muscles in your entire body. Now, how do we know that? Ready? Muscle spindle density. Every single muscle in your body has a certain number of muscle spindle fibers that are going to send information to and from the brain, okay? The upper neck muscles, or the suboccipitals, have the highest density of spindles per gram compared to any other muscle group in your body. And as you can see here, starting with obliques capitis inferior, coming in with 242 muscle spindles per gram of muscle tissue. This muscle right here is the most sensitive muscle in your entire body, right? Side note, when this muscle stretches tight enough, it will impact the C2 nerve, right? It's going to entrap it, which is going to cause cervicogenic headaches, right? So this is why we are able to help so many people with headaches just based on this region right here with that greater occipital nerve. Okay, now coming in second, we have obliques capitis superior coming in with 190 spindles per gram. Third and fourth, we've got rectus capitis posterior major, rectus capitis posterior minor, okay? Coming at 98 muscle spindles per gram of tissue. And then just to do a comparison here, biceps brachii right here, 97 total muscle spindles, right? This isn't per gram, this is total. And as you know, the bicep muscle is a lot larger and weighs a lot more than all of the upper neck muscles combined. So when these muscles stretch, you do need to know that the mechanoreceptors are going to activate, right? Think of mechanoreceptors being the ones who sense that the muscle is stretched and now have to communicate that to the brain. Now, these are very sensitive when any muscle is going to be exerted in a quick motion. So just keep that in mind. Also, 82% of all mechanoreceptors in your body are going to be located in the upper cervical muscles and the ligaments. Just incredible. Okay, so once the mechanoreceptors are signaled, they are going to travel, right? It's like a neurological signal right here. It's going to be sent up lamina 7 of the spinal cord. And not to get into too much detail, just know that the spinal cord has a total of 10 different sections or 10 major pathways in which information is sent to and from the brain. Okay, so as the signal is going to continue, it's going to head up to the cerebellum, right? The posterior lobe of your brain. that is mostly responsible for controlling your equilibrium and balance. Okay, this signal is going to continue to the vestibular nucleus, which is located in the medulla of the brainstem, highlighted there, which is also going to be right in front of the cerebellum. Now, this region of the brain is highly responsible for eye movement, right, controlling the eye muscles, and works hand in hand with the cerebellum to keep you upright and posturally balanced, right? Talk about dizziness symptoms, right? Eye nystagmus, vertigo, people falling over. It's all related to right here. Okay. Now, so because the signal has reached the vestibular nucleus, it will tell the posture muscles on one side of the spine to contract and tighten. And hopefully everyone can see this animation here. The posture muscles I'm referring to are going to be your erectors, your rotators, multifidi, your QL. Keep in mind, these are the extensor posture muscles here. Okay, real quick point on scoliosis. First, here's the thing. People always ask me, can chiropractic help with scoliosis? And absolutely is that answer. Second, let's get into this study real quick, where researchers, they took a bunch of rats and they purposely damaged their vestibular nucleus. And in doing so, they also hooked them up to a EMG machine to specifically monitor their muscle tone. And at the end of the study, they imaged the rats again, took some x-rays, and found that 25% of them had developed a significant spinal scoliosis. And get this, on the convex side of the scoliosis, all the rats had hypertonic spastic musculature just pulling it over. And they knew this because they had them hooked up to the EMG machine, right? Okay, now enough on that, back onto human muscle imbalances. Now, once the posture muscles contract unilaterally along the spine, the body is going to compensate by leaning to one side or the other. Now, notice the green line in this photo. The line is at the center of her feet and goes all the way up. Now, normally, a good posture should travel right through the center, right? If she's balanced, of course, but as you can see with her body and spine are shifted way off center, leaning way over to the left. And just imagine how much more pressure is being placed on her low back discs. Just incredible, right? The longer that the posture is shifted off center, the more pressure is going to compress and be placed on those discs, right? And it's only a matter of time before they become less stable, begin to bulge, especially the low back area, right? L4, L5, S1, because they're carrying the weight of the entire torso and the upper body. Okay, now here's the problem. When the disc is initially injured from all this compression, right? Years and years and years of just whether it's sitting, just life, right? But the first thing that brain is going to do to attempt to heal it is it's going to coordinate the delivery of protein, water, and red blood cells to the area of the disc, right? And we call this inflammation. I'm sure everyone's heard that term before. So now that the area at the level of the spine is getting inflamed, right, it's going to make it feel a little bit stiffer, which could make it hurt more, could make you, want adjustments, a massage, some more stretching, could make you want a cortisone injection, right, pills, anti-inflammatories, ibuprofen, anything to try and reduce that inflammation. By the way, what is the #1 cause of disability worldwide? Back pain. By the way, what is the most common reason workers go home from work early and losing a bunch of money for the company, right? Back pain. Okay, what do we spend $253 billion annually? What do? Managing back pain. Just imagine if we corrected the problem before the pain started, what this country would look like, what we'd be able to accomplish. It's just incredible to think that way. Anyways, okay. Now, as you may know, all pain really is a protective mechanism of your body, right? Pain is designed to stop you from moving. Why? To protect the spinal cord and what's most important to the body, right? Those spinal nerve, the nerves exiting the body, just making sure that they do not get damaged, right? So the body is going to give you pain, so you seize up, so you don't move to injure the spinal cord, right? But regardless, if you have symptoms or not, the brain knows exactly what's going on. So if you take a pill or you neglect it with a needle, right, you're covering up the problem. Just know you're making it worse, making my job harder down the road, okay? Now, if there's one concept that you leave here with, please understand what I'm about to tell you, right? If you don't fix what's wrong structurally, catch up here. If you don't fix what's wrong structurally, then at a certain point in time, your brain is going to say, hey, this inflammation is not strong enough, right? There's not enough stability. Now, we've got to do something extreme here because we are losing the health of the disc. So the last thing the brain will do is going to purposely coordinate the stealing of calcium from unimportant bones in your body, and the calcium is going to be dragged through the spine and dumped around where that injured disc is. Of course, the goal here is to try and concrete that weak area, giving it as much stability as possible, right? Now, after this happens, it's very common to see two separate diagnoses, okay? The first is going to be osteopenia, osteoporosis in the bones that the brain stole the calcium from, right? It's commonly, you'll see it in the arm bones. Now, the second is going to be osteoarthritis and bone spurs. And that's going to be evident at the level of the injured disc, okay? And keep in mind, all that really happened was that the calcium simply moved from the arm to the spine in this case, right? One area of less importance to one area of more importance. Okay, now, once we see that, I do want to say one more thing, right? If you do know someone who has bone spurs, osteoarthritis, right, and they were told it was caused by old age, just know that that's completely false. I know several old folks, we'll put that in quotes, right, who don't have any bone spurs, no osteoarthritis in their spine, right? They're healthy, active individuals. So to say that just getting older is what causes osteoarthritis and bone spurs, it's just completely bogus. I'm just blown away by how many of my patients tell me that their health professional told them that it's just because they're getting older, right? Cop out. Anyway, I don't want to go too much into detail there, but just remember, the problem isn't that the disc is getting old. The problem is that the disc is losing its integrity and becoming extremely weak after all the additional compression that is being placed on it from being shifted off center, right? All the years of just the bending, the twisting, the falling, the weightlifting, the airplane rides, just the falls from birth, kindergarten, all the way up through high school, college, right? And all of these things we do, it's just, it can and will and does, and 100% of people cause the spinal vertebra to shift out of the normal position and compress those spinal discs. So just keep that in mind. Okay, now, when the head and neck is off center, it's very common to see patients develop a shoulder that is higher on one side compared to the other. And when this happens, the shoulder muscles are going to have to tighten to adapt, right? You see this adaptation in the muscles from the structure being off center. Keep that in mind, right? Structure dictates function. Okay, but yeah, this is where we'll see an increased risk of shoulder, like impingement, right? Impingement syndrome. We got rotator cuff injuries, like you name it. And then once the shoulder compensates, now you see the elbow compensating, and then you start to see the golfer's elbow go up, the tendonitis, and just all the repetitive motion injuries start to become a lot more relevant. Same thing with the hips. We see that, when the spine's crooked, it's so common to see the hip is going to be compensating, right? Higher on one side compared to the other. You see that the hip flexors, the quads, the hamstrings, they're all going to have to tighten to adapt, which of course is going to impact the knees. And then when you exercise the knee, you're just driving down that much more pressure. It's like no wonder why we have so many people with knee problems. It's just incredible. Okay, so just ultimately keep in mind with all of this, the overarching concept here is it's an above-down cascade. the neurological case will always support the above down science, starting with the brain and what's closest to it, okay? Because here's the thing, if you break your neck, does your back work? Absolutely not. But if you break your back, does your neck work? You betcha. Anyways, I hope this helps. Here's the thing, the health detriment from head and neck injuries is just far more than what anyone can only imagine. So again, please take the time to take care of your neck. And with that, of course, if you have any questions, email me, drburt@eliteuc.com. But otherwise, take care.